So today we're talking about cestodes. So you might know them as like the tapeworms. Let me tell you, I used to be really scared of tapeworms as a kid because there would be like TV shows where they would have people like, I don't know, just all these worms would just come out of them on like TV and stuff, and I used to be scared of them. But yeah, we're gonna learn all about the cestodes today. So they're just another parasitic class within phylum Platyhelminthes. Like I said, they're known as tapeworms. So they're segmented. They're also ecolomates, which means they don't have a body cavity. And what's different compared to the worms that we talked to last week was these guys actually do not have any gut or mouth. So just their general anatomy. So here we have their head, which is known as the scolex. It has like suckers that's used for attaching to the host intestine. They may also have hooks surrounded by a structure called the rostellum. And so they have like a neck that then connects the scolex to what's called the proglottids. So the proglottids are like the segmented just form of the parasite, which contains all of like the rest of the reproduction organs. And so all of the like proglottids added up together is referred to the stroblia. So that's what you would kind of just call the whole body of the parasite would be the stroblia. And so each segment or each proglottid is hermaphroditic. So you have like the ovary and the testes all within one proglottid. So one like worm can be like thousands of proglottids long. So each and every proglottid has its own like reproductive system. And then they have this genital pore where the eggs would be released from. And so since they have no like gut or no intestines or anything, the way they absorb nutrients is just through diffusing gases through their tegument, which is just a word for like their skin. So any nutrients or waste, they just expel through their skin. And then like I mentioned, their scolex is what they use for attachment. So yeah, so they don't have any mouth or anything, so they don't like eat food. They just diffuse it through their proglottids. Yeah, so when you see like these hooks, don't think that they're like teeth. They're just for like attachment. Right, and then just going into more detail about the proglottids. So when you have what's called the gravid proglottid, that's when it's like a fully mature one in the sense that it's totally full of eggs. And so like all of the other internal like structures within the proglottid will start to like disappear, and then you'll just have one large uterus that's just full of eggs. So so the immature proglottids, like they won't have a fully developed reproductive system. So the mature form will have like these reproductive organs, and then gravid is when they lose their reproductive organs and just have one large uterus filled with eggs. And so sometimes the gravid proglottids will like detach from the parasite, and sometimes they'll be shed from like the host in the feces. That just depends on the species. Sometimes they don't come off, sometimes they do. And then you have craspatode. That's when the proglottids overlap each other. And there's acraspatode. The proglottids do not overlap each other. So like if we go back to here, just depending on if the proglottids like overlap each other, that's when you'll have those two different forms. All right, so we're gonna talk first about the pseudophilian cestodes. So that's just a particular order of cestodes. So what makes them unique is their scolex has what's called bothria, sucking grooves, instead of like suckers. So this earlier picture that we saw actually has suckers, so that's like not representative of the pseudophilian cestodes. Anyway, but we'll see pictures of them soon. So also what makes them unique is the proglottids will have like their genital pore on the mid-ventral surface, so that means that it'll be like kind of centered like on the front of the proglottid. And then the ovary is referred to as bilobed or dumbbell shaped. So the first parasite we're going to cover today is D. latum. So that's known as the broadfish tapeworm. It's also known as like the longest tapeworm that's infecting humans. It can reach about 15 meters, which would be 50 feet, which I know that's pretty crazy. And then in width, they're about 10 to 20 millimeters. And so, yeah, they can have about 3,000 to 4,000 proglottids, just depending on like how old they are. So most of the time they tend to be asymptomatic, but you can get complications such as like intestinal obstruction, like when they grow really large, or you can get gallbladder disease if the proglottids start to migrate around. Let me show you a video. Yeah, so that's just a dilatum adult in a small intestine of a human. All right, so talking about its life cycle, we first begin with like eggs. So the eggs can be passed from like the definitive host, which is usually people. So the eggs go through embryonation, which is when you have like a bundle of cells inside the egg, and then those cells like actually will eventually form into the little larvae. So they're referred to as chorocidia. So those will then hatch from the egg. They swim around in the water, and then they'll eventually infect their first intermediate host, which would be crustaceans. Those are like shrimp and krill, animals like that. Anyway, so the chorocidia then develops into what's called the procercoid. Those will just develop within the body cavity of the crustaceans. So then a fish will come and like eat the crustacean, and then so the procercoid larva will then be like released into the fish, and then they'll begin to develop in the fish. And then so what can then happen is, say like this smaller fish can be eaten by a person, or even like a predator fish can then become infected again by eating the little fish. And that's just multiple ways how a human can get infected. So really just by eating really any like undercooked fish, and then the adult will then colonize in the small intestine. And then not just humans can be like the definitive host, but really any other mammals that might eat fish can be the definitive host. All right, so looking at like the scolex, we can see that, yeah, instead of having like suckers, they have the bothria. So they're two like grooves kind of, and that's what they use to attach. I think this little drawing kind of makes it look more clear. Yeah, so they don't have any hooks or suckers. And then this picture here shows the proglottid. So you can really see here much better the shape of the ovary or the uterus, of how it's that dumbbell shape. It's also referred to like as a rosette shape. So that's really indicative of dilatum and these pseudophilian cestodes. Another thing, the proglottids are wider than they are long. And yeah, like I mentioned, the rosette-shaped uterus, you can see here. And then also here in the P, that would be that genital pore. So you can kind of just see how it's like on the front of the parasite. This is actually like a side view. So it would be like here in the front view. And that's where the eggs are discharged. Right, and so looking at the egg, it actually looks kind of similar to some of the parasites we covered last week, in that they have an operculum, and it's like a little bottle cap, how it kind of just pops open and then releases the larva. Let's see. And it does have a really small like, little knob at the opposite end there. So looking at the chorocidia, so this is like the larval form that hatches from the egg and then infects the crustacean. So it has cilia that allows it to like swim around in water. It also has 3 hooks that can help it to like attach to the crustacean. And this is the procercoid that develops within the crustacean. So it also has hooks that helps it just attach. The hooks are located on this like appendage called the cercomer. It's just really an appendage that they use to help for attachment. And here's the pleurocercoid, which this is what would be found in the fish, and then this is what would infect humans. So they, they're like Scolex looks pretty similar to the adult form in the sense that you do see the Bothra on them. All right, so that's the only pseudo-philian cestode that we're going to talk about today, because overall the next ones that we're going to talk about, known as the cyclophilidian cestodes, those are like the ones that more commonly infect people, and the ones that are like overall more like medically relevant. So anyway, yeah, so these cyclophilidian cestodes, they tend to just infect humans and domesticated animals more. So what makes them different from the previous cestodes that we talked about was, like I mentioned, they have like 4 suckers instead of the Bothria, and they always have 4 suckers. They're not going to have less than 4 when they're adults. And then some of them might have hooks, some of them don't. Where, as before, the pseudophilian ones that we talked about before, they never have hooks. Where these ones, sometimes they do. And then so, also the genital pore is usually like on the side, so like laterally. Usually they have 1, but some of them can have 2. So yeah, so the genital pore is not like on the front or in the center, it's like on the side. All right, so talking about our first one, this Hymenopilus dimintua. So this one has an arthropod as its intermediate host. It's like a type of beetle. So this one is known as the rat tapeworm because it tends to typically like infect rats, and the human infection is actually pretty rare. There's only like a few documented cases throughout like the past 100 years, but it still is, of course, possible for them to infect humans. So the proglottids are known as craspatode, so that means they overlap. All right, so here's a rundown of the life cycle. So again, it starts with eggs, and then they then have to be ingested by an arthropod. It's usually like a rice beetle. So then you have what's called oncospheres. Those hatch, and those like penetrate the intestine of the little beetle. Then you have what's called Cestodes. Those begin to develop within the beetle. And then if a human or if a rodent like eats any grains that might have this beetle inside of them, that's how the human can get infected. So then the Cestodes, they just move to the small intestine, and then they begin to develop into adults. So we'll see a better picture later, but the scolex is actually inside of this Cestodes, and it actually kind of has to fold like inside out when it develops in order to like fully form the adult form. So anyway, so once the scolex is fully formed, you have just the adult form inside of the small intestine. Eventually, the gravid proglottids form, so that's just when they become full of eggs, and then the gravid proglottids just release eggs out of the feces of the host. All right, so here's like the adult form. So here we can see our 2 suckers. Remember that there's always 4, but just, from some angles, you might not see all 4 of them. So here's like a more detailed electron microscope image. You can see the, suckers more detailed. And then the rostellum. So you can see that there's no hooks here. So that's something that's like indicative of this species. And then here's just more detailed microscopy images, and then here's like what the egg looks like. I'll go into more detail about the egg right now. All right, and so here's the cercoid larva. So this, yeah, like I mentioned, exists within the arthropod intermediate host. And then once the like mammalian host eats the little arthropod, that's how the human or the mouse would become infected. And so yeah, so you can see here the little suckers are actually really tiny in there, and so they have to just grow and eventually develop into like the adult form. And so, like, on a side note, so I found a really, it was kind of a wild ride website when I was looking for pictures of these guys. It turns out there's this website where they sell these cysticercoid larvae for people to actually eat them. because they're used, or they're thought to be used as like a therapy for people who have, what do you call it, like autoimmune diseases. So like the theory is that like your immune system is kind of bored because we live in such a clean environment that you should kind of, you know, ingest some things that maybe people of the past would be more exposed to, because like since we live in such a clean environment overall, we would rarely see a parasite like this. So they think that like, you know, ingesting something like this kind of will give your immune system something to do and kind of go after these guys instead of causing your autoimmune disorder, or instead of like giving you allergies and annoying stuff. So yeah, but that website kind of said that, oh no, these guys are not in the parasitic form, they won't infect humans, but it's possible. So I wouldn't recommend eating these guys. So yeah. All right, so moving on to the next parasite, H. nana. So this one actually is the one that is known to infect humans much more commonly than the previous one. So this one doesn't need an intermediate host, or like the beetle doesn't need that. Let's see. So overall, the adult worm is a lot smaller than H. diminua. It's actually known as like the dwarf tapeworm because of it. So let's look at its life cycle. So yeah, so overall you have the egg here. So the egg would be ingested by like the insect, and then the cystosporoid would then be developed in the insect. Or what can also happen is the egg can just be in contaminated food or water, and then the human can just directly ingest the egg, so the human doesn't have to ingest like the infected arthropod or bug in order to get sick. So then what occurs then is like the oncosphere, like previously, will then hatch, and then you'll have the cystosporoid begin to develop within the human. That's like what'll happen if the human just eats the egg directly. And so yeah, they form their scolex, and then that then allows them to just attach to the small intestine, and that's how they'll, you know, begin parasitizing the mammal. They also then form these gravid proglottids. The gravid proglottids release eggs that then get excreted through the host. Or what can also happen is, over time, the gravid proglottids, when they fall off, they can also just disintegrate. And this disintegration just causes the eggs to be released. And then what can also happen is, like, let's say if the eggs are not excreted and if they just stay within the intestine, you can just keep getting recurring infections. All right, so some like morphological differences between the previous parasite that we talked about. This one does have hooks. They're kind of hard to see, but you can kind of see them here. You also see the two suckers here. And then, so like as we go down the parasite, the gravid proglottids are always at the end. So you have like the immature proglottids at the very front, and then as you go down the parasite is when they begin to mature. So here's just a picture of the proglottids like close up. You can see like the eggs inside of them. Here's like a close up of the eggs. So the eggs have hooks, but they're kind of hard to see through light microscopy because they're so small. And so we're going to compare the eggs between the two Hymenopilus species, Dimentua and Nana. So the Dimentua eggs are larger. The Nana eggs are smaller. They also have what's called as polar filaments. So there's kind of like this like pinkish layer kind of surrounding the egg. That's what that is. It just originates from like inside the egg, and it just extends outward. It's not really known like what function it has, but you're not going to see that in Dimentua, so that's just a really good way to differentiate the two. In this picture, you can kind of see the polar filament is kind of like this purplish tint to it. All right, so I don't know, moral of that story is don't buy tapeworms for you to eat. Okay, so Moving on to Dipylidium canium. So this one is kind of known as like the flea tapeworm, the cucumber tapeworm, or the double-pored tapeworm. So this one, you have to ingest fleas that are infected with the parasite in order to be infected with it. And so this one, it tends to be asymptomatic, but something that can occur is that the proglottids themselves can actually be visible in the stool instead of like just the eggs. So these ones do like shed their proglottids. So let's see how the life cycle goes. Yeah, so you have the gravid proglottids are actually passed through the feces intact, so they might actually be visible in the feces. And this can occur like in animals or in the human host. So we'll see that the eggs are contained inside what's called an egg packet. So like the packet has to, break open, and then the eggs will eventually like hatch. And then so then the flea would then like ingest the eggs, and then they would hatch into the oncosphere inside of the flea, and then they would develop into the cystostoroid inside the flea. And then so once the flea like begins to mature, they'll still like carry this parasite inside them. And then so the host then has to eat the flea. So that could be any mammal, like as a dog or a cat, which it tends to be very common in dogs and cats. This can also happen in a human if a human somehow ingests something that is contaminated with a flea. So again, the scolex just has to develop, and then that then allows the host to, or the adult to colonize the small intestine. Yeah. So the reason why it's called the double-pored tapeworm is because it has actually 2 genital pores. So like how I mentioned earlier, these parasites, the genital pore is always on the side. It's not like in the front here. So, but these ones are unique in that they have 2, or the other ones we covered, they only had 1. So, yeah, so they just release their eggs through these 2 pores. And so here's what their eggs look like. So their eggs are inside of a little egg packet. So the egg packet can contain 5 to 15 eggs. They can even have more, but 5 to 15 kind of just tends to be like the average. And here is like a close-up view of like a proglottid, and you can see the eggs like actually inside of there. Yeah, so when like the egg packet gets ingested, it will eventually like dissolve and then release the eggs so that they can hatch. And then here's what the scolex looks like. So it has like the 4 suckers. Its rostellium is actually retractable, so it can either come in or out. And it does have hooks, which again, the hooks are they're used to attach to the intestinal wall. And then here you can kind of see the adult is kind of different in shape. The proglottids, they're kind of like round. They're kind of called like rice kernel shape because they're more oval than like the other ones that we saw previously. All right, so then moving on to tinea. So tinea is probably the more common one I'd say that people think of when they think of like tapeworms, because tinea is the genus that affects, that you get from like pork or beef. So tinea overall is probably the more common one that infects humans. All right, so there's tinea solium. So this is the one that you get from pork. So they can be about 2 to 7 meters in length. And yeah, they can have up to 1,000 proglottids. And each proglottid can produce 50,000 eggs. So, that's a lot. Anyway, so this parasite can actually be very dangerous because the oncospheres, they can actually like escape the intestine, and then they can then travel through like the bloodstream, and they can travel to other organ systems such as like the muscles, or they can even reach to the central nervous system, and then they can start causing just neurological or just mental problems once they reach the central nervous system. And then so these cystosterae will then like develop outside of the gut. And so this is what's called cystocerosis, when you have this parasite outside of the intestines. And then when it reaches the central nervous system, I believe it's called neurocystocerosis. So that can be a fatal condition. All right. So basically what happens is you have here you have the gravid proglottids of the Tuatainia species. We'll talk about the other one right now. So the eggs, so you can have either the eggs or the proglottids pass through the feces and into the environment. So here we're talking about the pig form, so Taenia solium. So the pigs get like infected by this parasite by eating like grass or something that might have the eggs like in it. So the oncospheres hatch, and then they just penetrate the intestinal wall, and then like they escape the intestines, and then so the oncospheres then develop into cystosterae, like within muscles. And so in these like cattle animals, they tend to just stay in the muscles. But then when humans like eat like raw or undercooked pork or beef, that's how the human gets infected. And then yeah, and so once in the humans, they, you know, can just potentially travel to other parts of the body, not just the intestine. All right, so here's what the scolex looks like of solium. Here you can like clearly see the 4 suckers, and then they have 2 rows of hooks on their rostellium. And here's just another angle. You can see the hooks and the suckers pretty clear. All right, and so the eggs of the Tuatainia species, so the pork and the beef one, they're both indistinguishable from each other. So they tend to be about 30 or 35 micrometers in diameter, and they're radially striated. That's what these like little lines are. They're just striations. They don't really have a purpose. It's just like a physical feature that they have. And then here we see there's hooks that you can see within the eggs. And so here's the gravid proglottid of Taenia solium. So the way you would really differentiate the 2 Taenia species would really be by looking at their proglottids. So the gravid proglottids are like longer than they are wide. And here, you know, like as the uterus gets like swollen with eggs, they form what's called uterine branches. So you kind of see how they're like spreading like to the side outwards. So that's what those like lateral uterine branches are. So they have about 7 to 13. All right, and then so moving on to Taenia saginata. This is the beef tapeworm. And so this parasite, it actually lacks rostellium and it lacks hooks. So that's really the best way to tell apart the adults of the Tuatainia species is solium has hooks, and then saginata does not have hooks, and then their proglottids also look different. We'll see that right now, where saginata has more branching in like the uterus. And so something that's different in terms of like the pathology is saginata won't cause cystocerosis, so they'll just stay within the intestine. They won't escape and infect other organs. So let's show you an endoscopy of this one. Let's see. I think this video is more interesting because it's actually more descriptive.
Here we perform oral double balloon enteroscopy in a 40-year-old woman who was admitted to our clinic having experienced abdominal pain for nearly 4 years. Abdominal CT and a small bowel series disclose thickening of the jejunum and ileum. She had previously undergone several diagnostic endoscopic examinations, including gastroscopy and colonoscopy, which were normal. The long white flat string that you see moving slowly in the distal duodenum is a tapeworm called Taenia saginata. Taenias are intestinal tapeworms that are only definitively hosted by humans. Indeed, in the present case, T. saginata are seen throughout the distal duodenum to the proximal ileum. This is a whole clue of tapeworms. The length of an adult worm is usually less than 5 meters. However, it may reach up to 25 meters, like in this case. An estimated 80 million people are colonized with beef or pork tapeworm. Humans become infected by ingesting raw or undercooked infected meat containing cysticerci. Most people colonized with adult T. saginata are asymptomatic. Those with symptoms complain of mild abdominal discomfort, loss of appetite, or change in stool pattern. At withdrawal of the endoscope, we can appreciate the gigantic worm burden within the small bowel. Praziquantel and niclosamide are effective treatment alternatives. In this patient, niclosamide treatment was started after diagnosis and symptoms resolved approximately 2 weeks later.
So yeah, that video, it said that it was 25 meters. That's 82 feet. Yeah, so they can get like super long if they're just, allowed to just live, undisturbed. Yeah, I think it said that she had it for like 4 years. So yeah, just the longer they're left alone, the longer they can grow. All right, so yeah, so looking at the scolex, like I said, there's no hooks on this one, so that's a good way to differentiate the two Tinea species. And then here's just the body of it, how long it can get. They remind me of like ramen noodle. And so here's the gravid proglotid. So you can see here there's like a lot more like uterine branches. So they tend to have like 12 to 30. They can have more. So yeah, so this is also another just good way to differentiate the two Tineas, how many uterine branches they have. And then up here there's the genital pore from where the eggs would be released from. All right, I think this is the last parasite for today. And then I can stop grossing you out with tapeworm videos. So next one we're covering is Echinococcus granulosus. It's kind of a small one. I mean, well, compared to that one. So it's like 2 to 7 millimeters long. And like all of these other ones, it resides in the small intestine of the definitive hosts. These ones can also like escape the intestines and then can move through the circulatory system and then infect other organs. Usually they prefer to go to the liver and the lungs. That's kind of what they like most. But they can go to other organs, but it's kind of rare. So when they escape to like other organs, they'll form a cyst known as the hydatid cyst. It's just very thick-walled cyst that just allows them to survive in these, external or other environments that aren't in the intestines. All right, so here's just a life cycle of it. So it starts out with like the adult in the small intestine of the definitive host, which would be like usually dogs. The intermediate host would be like farm animals, kind of like sheep here. So what would happen is if the sheep is like, eating grass or something that's contaminated with feces from the definitive host, that's how like they would get infected. And then say like if a wild dog then, kills this animal and they eat the animal's meat, that's how the dog would get infected, or the like definitive host. And so the way that a human can get infected is a human can also get infected by ingesting eggs from feces that's, food that's contaminated with feces, not really from like meat. So then the oncosphere would then like hatch. They would then penetrate the intestinal wall, and they would escape the intestine. And then once they leave the intestine and then go to like somewhere else, they would then form the hydatid cyst. And then inside of this cyst is where they would start to form their like scolyxes, which is referred to as like the protoscolyx. So yeah, so this would form, and then just as it begins to mature, it starts to develop other structures that it needs to attach in its adult form. So eventually it just grows nice and big into its adult form, and then the adult form then just remains in the small intestine. Yeah, so the adult form will like stay in the small intestine, where like the hydatid cyst, like after they're developed, they kind of like return to the small intestine. All right, so here's like the hydatid cyst. So this here would be like the entire like cyst wall. And then so inside of that cyst wall, you see the little protoscolyxes. So like here, like labeled in A, that would be like the cyst wall. And then B and C would just be like the internal like tissue of that like cyst wall. Yeah, like this laminated layer and this germinal layer. And then so the actual protoscolyces are here, like in E, and then F is just showing that they have little hooks developing. All right, and so here's the adult. So the adult, I guess, is the most unique looking out of all the ones we've covered today, because the very last proglotid would be the gravid one, and it's like very large in comparison to the rest of them. Yeah, so that's kind of why they don't get very large, is because they just hold on to this last gravid proglotid. Yeah, so they only have about 6 proglotids. And yes, like I mentioned, the very last one is the gravid one, and it's just the largest one. So their scolyx, like all these other ones we've covered, they have 4 suckers, and then they also have hooks on their rostellum. Yeah, so just as you go down is how the proglotids mature. And I think that's it for today. So does anyone have any questions about tapeworms?